Jack, but we don't see his face. So
Oh, yes.
Bruce will be absent. I have heard that Ken and Marshall will join.
I'm here.
Marshall
It's
just
Marshall.
just moved his face.
Yeah, I'm technically challenged at the moment, but I'm here.
Okay.
Yeah, we should remind board members that to vote, we will need to see them.
Yeah. So to vote, we will need to see your faces if you can get your video working. We've got a quorum. All right. Well, Madam Chair, I believe that we are ready to roll when you are.
Okay.
All links up, running, recording started.
The YouTube live stream is going and we are recording.
Great. We are live, being recorded and ready to go.
Okay, I am Michelle Stevens. I'm sitting in for Dr. Bruce Benjamin today. I'd like to call the meeting to order and announce that all the requirements have been met for the Oklahoma Open Meeting Act. And I want to remind everyone that that even though it's a virtual meeting, we will observe all the rules and decorum of a regular in-person meeting. And I would like to welcome all of those who are joining us via Zoom or YouTube live stream. And also announce that if this meeting is disconnected, the meeting will recess and reconnect and reconvene. If the connection cannot be restored after an hour, this regular meeting will be reconvened on Friday, November 13th at 2 p.m. I would also like to state that there will be a public comment period at the end of the meeting. And if you're joining through your computer on Zoom, you can raise your virtual hand or state your request in the chat feature. If you're joining by phone and you would like to participate in the public comment, text your name and phone number to 405-642-6860. Again, that public comment period will take place near the end of our meeting, and I will recognize you when it's your turn to speak and you will be unmuted. Comments will be limited to 2 minutes and must pertain to the items on our agenda. Persons who disrupt the meeting with offensive or obscene comments or chat will be removed from the Zoom conference. At this time, I want to ask, have the board members had time to review the minutes from the August and the October meetings? I would like to entertain a motion to approve the August 27th regular board meeting minutes. I need a
Motion by Kenro, second.
Second.
Second by Jack Allen. Please call the roll.
Michelle Stevens,
yes.
Jack Allen,
Yes.
Stacy Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Also, now we need to approve the minutes from the August 28th, 2020 planning retreat.
So moved.
Second.
Second.
Motion by Jack Allen, second by Casey Kilblain. Please call the
Yes.
roll.
Michelle Stevens,
Yes.
Jack Allen,
Yes.
Stacy Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
I would also like to request that we approve the minutes from October 2nd, 2020, our special board meeting.
So moved.
Second.
Jack and Casey.
Michelle Stevens,
Yes.
Jack Allen,
Yes.
Stacy Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes,
Yes.
All right, everyone should have a copy of the proposed meeting dates for our 2021 board meetings. Those were in our packets. I will entertain a motion to approve those.
So moved.
Second.
who was the second?
Who-
Ken Rowe.
Thank you. Michelle Stevens,
Yes,
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes,
Yes.
all right. An update on our board committees. We have the committees listed with the members and the descriptions in your packet. This year, it will be Agency Operations Committee will be Marshall Snipes and Michelle Stevens. Programs Committee will be Susanna Gattoni and Jack Allen. And then the Public Information and Outreach Committee will be Casey Kilblain and Ken Rowe. I need a motion to approve our committees and descriptions.
So moved.
Second.
Jack Allen was the second? Yeah. Michelle Stevens,
Yes,
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes,
Yes.
all right. And now I'll turn it over to the Executive Director for her report. Julie?
Great, thank you very much. On page 17 in your packet, we have our strategic map, and I believe we also have a slide to that. Bruce was planning to be here, but was unable. And one of the things that he wanted to highlight was our ongoing investment in high priority research. Bruce participated, Dr. Benjamin participated in the OCASCR steering committee as they did their re-grant process this fall. And he said it was very thorough and he was glad to be a part of the discussion. So this seemed like a really good opportunity to give you some highlights from the 3 research grants that TSET funds. Starting with the Oklahoma Center for Adult Stem Cell Research, they have awarded 24 grants, and of those 24 grants, 16 were research grants totaling more than $2.2 million. Of the research grants awarded, almost $2.4 million was matched by awardees' institutions, either through direct or indirect assistance. They've also had some of their funded researchers achieve outside funding. There was a $1.2 million NIH, National Institutes of Health grant to study diseases of aging. Another one that was $1.6 million NIH grant to discover the biomarkers that aid in the diagnosis of arthritis. Some of the new grants awarded by the steering committee include looking at ways to understand how intestinal diseases impact premature infants, and we know that smoking causes an increase in premature births. Also, people who smoke are more likely to develop an autoimmune disease, and one recent grant awarded would study DNA variations related to lupus in order to understand the cause and generate more effective treatment. Also, obesity causes heart disease, and there was a grant awarded that would look at how the nervous system is impacted by obesity, which could lead to new therapies to prevent or treat heart disease. At the same time, smoking causes respiratory diseases and increase the risk for complications from COVID-19. There was a researcher awarded grants to look at that. At the same time, the Stevenson Cancer Center, one of our other research grants, has been busy this fiscal year. Researchers from Stevenson Cancer Center received 23 new grants from federal funders, including National Institutes of Health, the Department of Defense. Those 23 new grants will bring in about $18.4 million in federal research funding to the state of Oklahoma. And that's often something that we highlight, how our dollars are being leveraged by these researchers. At the same time, they have a researcher who recently got a National Cancer Institute grant to study the potential health effects of electronic cigarettes and seeks to determine how the use of e-cigarettes damages and modifies DNA, mutation rate, gene expression that could increase the cancer risks in humans. Some of their community-based research also includes a partnership with the Cherokee Nation and Oklahoma State University to expand the capacity and infrastructure at Cherokee Nation to address high cancer rates. So that would be bringing together folks on either end to provide additional access to screening, as well as understanding how cancer works within this specific population that is unfortunately disproportionately represented in our cancer diagnosis and death. Also, the Stevenson Cancer Center continues to be a national leader in conducting cancer clinical trials. The Stevenson Cancer Center was one of the top centers in the National Cancer Institute's clinical trial network for enrolling patients. They currently have, for the first 6 months of this fiscal year, 202 patients participating in treatment clinical trials and 86 patients participating in the early phase 1, phase 2 Oklahoma TSET clinical trials. Moving on to the TSET Health Promotion Research Center, which was formerly known as the Oklahoma Tobacco Research Center. Their new name change has gone through, and the research center has been successful in filling vacancies. They've hired 3 new assistant professors who include a variety of expertise, including mapping and geolocating different patterns that may lead to increased risk for cancer, certain behaviors, where do they happen, and how can you use that data for possible intervention. At the same time, 7 new grants were funded from National Institutes of Health, NIDA, National Cancer Institute, including a study that looks at ways to help pregnant, postpartum depressed smokers quit. In addition, they are working on, they have a researcher there working on improving access to cigarette cessation treatment among African American smokers. And also kind of an interesting thing on the runway, looking at how low cost incentives for quitting smoking can be delivered via smartphone apps, and then using also mobile equipment to verify that folks have quit. So that's something on the runway. At the same time, the TSET Health Promotion Research Center continues to run the Tobacco Treatment Research Center, which has enrolled over 1,000 participants since it started in 2017. So increasing access to intensive smoking cessation intervention. And finally, a recent publication by Dr. Busanel's lab shows that smartphone-based smoking cessation treatment may be equally effective as in-person smoking cessation counseling. And there's a current study going on in Oklahoma that will assess how that works and if there are benefits or innovations that we could potentially put to use. Any questions on those items?
Julie, tell me the name again of the Tobacco Research Center. It'll always be that to me. I'm sorry.
Yes, it is now the TSET Health Promotion Research Center.
Okay, thank you.
Any other questions on the research update? All right, I'll move on to just a quick overview of things that have been going on at the agency. In the past quarter, we've worked with our executive team to develop annual goals for agencies and programs in line with our strategic plan, refining metrics, long and short-term goals for the agency as well as our programs. We have identified the need for a strategic plan for data management, and we're currently working with a data analytics group at Oklahoma State University to identify needs and gaps. This is something that will be ongoing this year, but some innovation and kind of systems that we are looking to put in place. Also, we've participated in meetings with the Legislative Office of Fiscal Transparency. The Legislative Steering Group has identified TSET as one of the top priorities, and so we've had some initial meetings and information exchange. Thank you to Michelle for participating in that meeting. And also a real quick highlight, Sana Paulson, our Director of Health Communications, was named 2020 Marketer of Oklahoma. Congratulations to Sana and all of her work. The efforts were honored by the American Marketing Association of Oklahoma City. And you'll hear more about that in her report, but I just wanted to highlight that. Any questions on those items before we move forward? Okay, hearing none, I will move on to our staffing updates. You can see that we have added some new staff, replaced filled vacancies. Chase Havrick has been hired as Health Communication Manager, Andrew Underkoffler, Program Manager, and most recently, Annalisa Phillips as Executive Assistant and Board Secretary. So Annalisa is learning your voices as we're doing these motions today. So welcome to those new staff. We are also looking at some scheduled retirements in the new calendar year, and we'll be looking to make those hires here in the next couple of months. Any questions on those items? All right. I'll move on to an update on State Question 814. On November 3rd, Oklahoma voters rejected State Question 814 that would have sought to reduce the allocation of the annual master settlement payment that goes into the TSET endowment. 58.8% of those who voted rejected the proposal, with 41.2% voting in favor of it. I think it's important to note that almost 870,000 Oklahomans affirmed the infrastructure of TSET and how we work. So we will continue to move forward. TSET celebrates its 20th year of existence, and it's a highlight to have been affirmed in our structure by voters. Any questions on that? All right. And moving on to item E, an update on Oklahoma health behaviors. As you can see in your packet and in the slide, we have new data released over the past few weeks. Oklahoma has the 11th highest rate of smoking in the country. A little silver lining is we are no longer in the bottom 10. So that is great. We're seeing a decline in our smoking rate. It's as low as it's ever been at 18.9%. And for the second straight year is declining. The national rate of smoking is 15.3. We see our highest rates of smoking among adults that have less than high school education and household incomes less than 15,000. And among racial and ethnic groups, we see our highest rate of smoking among American Indians, who have a rate of 30.7%. And I think this is a particularly a good metric for us to quote, the adult quit attempt rate has remained fairly steady in Oklahoma and exceeds the national rate for quit attempts for 2019. At the same time, the percentage of homes with a smoke-free policy, meaning fewer people are exposing their loved ones to toxic secondhand smoke, has increased from 82.8% in 2018 to 86.6% in 2019. This is a question that we add to the behavioral risk factor surveillance survey in Oklahoma. So we don't have annual national data to compare it to, but I think that's quite an accomplishment. But even smokers understand the harms of being exposed to secondhand smoke, and they're doing what they can to protect their family. Also, we have some additional information on e-cigarette use. About 1 in 9 adults reported that they currently use electronic cigarettes. Oklahoma's rate of adults who use e-cigarettes increased from 8.7% to 10.8% in data collected in 2019. This is also not collected annually at the national level, so there's not really a good national benchmark to compare to. The highest rate of e-cigarette use among adults is those with a high school or GED level education and a household income of $15,000 or less. Among racial and ethnic groups, American Indians have the highest rate of e-cigarette use at 12.7%. And Oklahoma adults between the ages of 18 and 24 have the highest rate of use as well at 27.5%. Any questions about those tobacco numbers before we move on to our obesity data?
Do you have numbers for 18 and under?
We do, and that's in a separate survey, but I can definitely get that for you.
Okay, I appreciate that. Thank you.
Okay, moving on to obesity. In new data for adults released, Oklahoma is now the 4th in the nation, 4th highest obesity rate in the country. And you can see on the map there other states that kind of share that similar rate. Adult obesity has increased by 5.7% from 34.8% in 2018 to 36.8% in 2019. Obesity rates are highest among Oklahomans with an income of $15,000 or less. The lowest rate of adult obesity is among Oklahomans who have graduated from college at 33.3%. Younger Oklahomans are less obese than older Oklahomans, and our lowest rate is that 18 to 24-year-old. Their obesity rate is 26.6. And all of this analysis and data comes from the 2019 Behavioral Risk Factor Surveillance System. And this is something that we work with the State Department of Health to collect and to compile. It's a survey that's done on by phone, and it is done annually. Any questions?
That's very sobering that our
That-
rate is that high.
Sad.
Are there any other questions or comments before we turn it over to Dawn Bledsoe for the audit report? All right, Dan, sorry. Turn it over to you.
You guys hear me okay?
Yes.
Yes, we
Okay.
can hear you.
Thank you. Well, it should be, hopefully you guys got a couple of documents, the final documents that we issued. One is the required communication letter. I usually like to go over it first. I think it is a good overview of the audit, kind of results and process. And then obviously the really large documents, the audited financial statements. And so I've flagged a few individual things I'll touch on with it. And then obviously, as I go through any of this, if you guys have any questions, feel free to jump in and ask and we'll answer those. But kind of getting started on the required communication letter, of course, this is TSET's financial statement audit for the year ended June 30th, 2020. For the year, we issued an unmodified or clean opinion. So we didn't consider the financial statements to be in accordance with GAAP. There were no new accounting standards required to be adopted for 2020. The letter lists out several GASB pronouncements that will be kind of coming in over, I guess, the next 3 to 5 years, some next year. And as each of those come up, we'll obviously work with you guys and make sure they get properly implemented. Most of them, I don't think will have a material impact for TSET. We'll have to evaluate GASB 87, which comes up in a couple of years on the lease accounting. But for the most part, the rest of them, I don't believe will impact you guys. On page 6 of the letter, which is kind of gets past all those accounting pronouncements, kind of gets into some of the individual things we usually want to touch on. One of the sections in there, the significant estimates for TSET. By far the largest one, of course, is the fair value of investments at June 30, 2020. So we do quite a bit of work in that area on the investments, reconciling to third-party statements, sample testing individual investments to third-party to verify the fair values, as well as looking at just financial statement information, those type of things for private investments. Based on our test work, we were comfortable with the valuations that were included in the financial statements, so there was no adjustments there. The other section related to difficulties in performing the audit, outside of obviously the challenges we're all dealing with on COVID-19. And this year we did the audit basically on a fully remote basis. But beyond that, management was great to work with as far as working through that process, getting us what we need. And obviously TSET administrative staff, as well as the folks over at the state treasurer's office, because we have to do a lot of work with them as well on the investment piece of the audit. But we were able to get everything we needed to be comfortable with performing our test work and issuing our opinion. Also on page 6, it talks about disagreements with management. This more pertains to either a presentation issue within the financial statements or how to account for certain transactions. Did not have any disagreements with management on any of those types of issues for this year. So, and then kind of moving on to page 8 of the letter, kind of the bottom section there, we have items A, B, and C. These are pretty important items to kind of go over, but item A discusses if there are material weaknesses or significant deficiencies in internal control. We're required to report those items, and basically required to get an understanding of TSET's internal control system, kind of over the key areas for financial reporting, and if there's anything from a structural standpoint as far as segregation of duties or any issues like that, communicate those. Did not have any for 2020, even with some of the remote work issues and some of those types of things. Felt like they did a good job of maintaining good oversight and sign off and approval on transactions. Item B, if there's any fraud issues identified as part of our sample test work, we're required to communicate that. Did not have any such issues for 2020. And then item C, no any illegal acts or violations of laws or regulations. Once again, based on our sample test work, did not identify any of those types of issues for the 2020 audit. So kind of from an overall perspective, audit process, all things considered with the challenge of COVID, I thought the process went real well, and we were able to issue an unmodified opinion without any findings or issues. So with that, before I kind of transition over to the financials, I'll open up and see if anybody initially has any questions over just the audit process or the results of the audit. Okay. Well, on the financial statements, as I mentioned earlier, I've kind of just flagged a few things, key things I usually like to touch on. Obviously, it's a very large document, and since there aren't any new accounting standards adopted this year, your format's pretty similar year over year, as well as the financial statement format. So, but on pages 1 through 3 of that document, that's our internal auditor's report, and basically that kind of gives an overview of what our responsibility is in performing the audit, management's responsibility for the financials, and then ultimately on page 2, as I mentioned earlier, we render our opinion on the financial statements. And once again, it was an unmodified opinion or clean opinion that it was in accordance with GAAP for this year. So no issues on that piece. Then there's several pages. GASB requires a presentation of management's discussion and analysis. So pages I-1 to I-17 are the MD&A. A couple of the key things I usually point out with this is that although the MD&A does include some information from the audited financial statements themselves, technically the MD&A is not a part of our overall audit opinion. Our opinions on the financials and the footnotes are to that. Of course, the MD&A, I think it's a good document. It allows management to give a lot of information in terms of reasons for year-over-year changes, as well as, kind of a future outlook as far as an overview of upcoming things and issues that they may want to relate. So I think it's definitely good information for you guys to review and get feedback from management if you have any questions on that piece. Once you get past the MD&A, pages 4 through 11 are the actual financial statements for the year. As noted earlier, with no new accounting standards adopted, your format didn't change much there. Really weren't any new significant accounts or line items added in on the financials. Probably the biggest thing to note is that even with all the challenges that the market faced during FY 2020, still had an overall increase to the net position of about 31.9 million from 2019 to 2020. So still had a pretty solid year with all things considered on that piece. And so then once you get past the financials, we have a ton of pages of footnotes. And I hate to kind of glaze over a lot of it just because there's a lot of work that goes into getting all the information pulled together, especially on the investments. But really, there's only a couple of key things that I flagged I usually like to point out and touch on. So kind of jumping to page numbers 39 and 40. This is one of the several footnotes related to investments, but this one actually kind of shows under the requirements of GASB 72 that was adopted, I believe, about 5 years ago. The fair value levels, level 1, 2, and 3, and then those that are measured just at NAV, and asset value. And really that whole thing is kind of level 1 is you have a more active market to judge the fair value of those investments. And as it goes higher up to 2 and 3, there's less information available. So there's more judgment involved, I guess you would say, with coming up with the values. But and then that footnote is on a comparative basis, so you can kind of compare your levels and categories from 2020 compared to the prior year in 2019. Then jumping ahead a little more, pages 49 and 50. Of course, this is we've had this footnote for several years. It was basically a roll forward schedule of your fund balance. So this kind of shows you what came in and what's in the different buckets as far as what's permanently restricted in the assigned certified sector, and then what's unassigned. So, and then of course, I believe you guys are going to touch on it later on in the meeting, but there's a certification that occurs with at the investors meeting. So that occurred today, but there's some information about that as well. And footnotes following the table. Excuse me, my little dog's got a cough here. So if you guys heard that, he decided to come in by my desk. I apologize for that and do some coughing today. But then the final item I was going to touch on the footnotes, page 75, we did add a couple of sections in the commitment and contingency disclosure. COVID-19, just kind of a general discussion there. The management, obviously, to the best that they could, has tried to factor that into any estimates that were in the June 30, 2020 financials. And then, of course, we have to have the audit finalized by the end of September. And so due to that, at that point, state question 814 was still kind of an unknown as to whether it would pass or not. So we did include some language about it. Obviously, subsequent to that, it was voted down. So kind of a non-issue. But so those were kind of the key things I'd flagged. Obviously, there's a lot of information in there. So I'll kind of open it up and see if there's any areas I did not cover that people have any questions about.
I have one question.
Okay.
I'm on page 49.
Okay.
And my question is, there's $1.3 billion in our fund balance at the end of June. Is that correct?
Yeah, let me see. Jump back to get to the financials. Yeah, we're showing, 1,327,000.
billion. And according to what I've been told, we have about $1,073,000,000 that we've received from the tobacco companies since inception. And that difference is about $254 million, which is the amount of money, the way I read the rules, that we have to spend in the future. And some of that's through certified earnings. And we've got a couple of years worth of that in here. We've got the board of directors reserve in here. And if you add all of that up, there's a difference. Now, my question is is there anywhere in this audit report where I can look at and find the balance sheet number for the amount of unrealized gains that are sitting in the balance sheet?
Let's see.
I couldn't find it, and maybe I'm just overlooking.
Yeah, and I don't know that there is. The only thing I could see, I was going to go back to our investments footnote, because that would be probably the one place. Because I know it's not on the balance sheet itself, because we just reflect everything at fair value as of the date. But I was trying to remember. I don't believe we are required to do a footnote disclosure about that in the actual investments either. So our work papers would have that information, because obviously we get that from BOK, but I don't believe there's any specific spot where that's broken out separately.
Well, if you could provide that back to management, that would be helpful to us. For the other board members, the reason that's important is we have to look at, in this next spring, how much money we're going to spend, and we'll get more into that in my part of this report later. But we do need to understand how much is still sitting there in unrealized gains. So if you could provide that, that'd be helpful.
Sure. And you just want that just as of June 30, 2020?
Correct.
Okay.
Yeah, we can follow up with you and try to have that in advance of our January board meeting.
Okay.
That work?
Are there any other questions for Dan? Okay, thank you very much. That was all
Sure.
good.
Okay, I appreciate it. Well, I'll get that information for you guys.
Thank you.
Okay, thank you.
All right, we'll move on to Programs Committee Report by Jack Allen. Jack, you're muted.
Well, it's just as well, because my answer is the same. For some reason, I lost all that information. So Julie, can you take over? I apologize. I don't know what happened to it.
Okay.
It disappeared from my email.
All right. Well,
So-
I'll give an update, and you either can confirm or tell me that my update is incorrect, as you are a member of the program committee. So the program committee recommends the award of 11 incentive grants for schools with a total amount of $160,000. Jack, you can confirm that this was a recommendation from the committee?
It was.
Great. So no second is required. Is there a vote? And yes, I need to read the list of awardees for those who might be listening. So I'll go through that, and then you guys can do your vote.
Okay.
So we are proposing incentive grants to Grandview School in the amount of $9,500. Ravia Public School in the amount of $13,500. Burns Flat, Deal City Public Schools, $11,500. Oklahoma City Public Schools, $10,000. Latta Public Schools, $11,500. Stillwater Public Schools, $10,000. Kansas and that is in Oklahoma. Kansas Public Schools, 20,000. Little Act Public Schools, 6,000. Olustee El Dorado Public Schools, 5,000. Miami Public Schools, 5,500. And Locust Grove Public Schools, 14,000.
Hey, Julie?
All right.
Tessa let me know that the total that is in the talking points is incorrect. It's not 160,000. It's 116,500.
Thank you. So we are recommending the program committee 1,000.
116,500.
Great. So the program committee is recommending incentive grants to be awarded to schools in the amount of 116,500.
And I will entertain a motion to approve the healthy incentive grants for the schools.
So moved. I'm not sure you need to make a motion, but
Oh, okay. There we go.
just to vote, I think.
You're correct.
Okay.
Roll call. Michelle Stevens,
Yes.
Jack Allen,
Yes.
Stacy Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes,
Yes.
All right. Great. Jack, are you back with us or you want me to keep going?
I'm with you, but for some reason I mean, I guess I can follow along on the slides, but I can't pull up the email that had all that stuff in it. I apologize.
Let me resend that. We'll work on, it may have been resent to you by Annalisa.
Okay.
I
Go ahead.
will,
You keep talking and I'll. Yeah,
Got
I did get.
okay. The next item is discussion and possible action on healthy incentive grants for communities. The program committee recommends an award to the town of Allen at 10,000 and the city of McAllister at 20,000. Ready for a vote?
Michelle
Yes.
Stevens,
Yes.
Jack Allen,
Yes.
Stacy Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes,
Yes.
Update on OSU hospital residency program. Jonas?
Yes, if you look at, I think it's page 25 of your packet, the update provides you some history of our involvement with residency programs. The latest is that Dr. Pettit has recently met with Stillwater Medical Center officials. And although they haven't made a final decision, it's looking promising that they're going to be interested in some residencies. We haven't heard back. They're still doing their strategic planning. So at this point, we're just awaiting additional word from Dr. Pettit. Any questions?
All right. We'll go on to the update on the grant continuations for the health systems initiative.
Okay. So these begin on page 27, and at the August board meeting, the board was presented with an overview of the major accomplishments of each of these grant programs, which those are the Oklahoma Hospital Association, the Oklahoma Healthcare Authority, and the Oklahoma Department of Mental Health and Substance Abuse Services. So these grants are up for consideration for a new multi-year grant to begin July 1st, 2021. Your packet provides an overview of grant assets and opportunities to refine their work and sort of their work plan for the future. The program committee has recommended continued funding. However, we are still talking about each entity and what deliverables we would want for the next round of grants. We just need a decision of how to move forward. And I think if you look at page 27, you've got 3 funding options there, 2 funding. I'll go to item 1 and item 3. Either we move forward with 3 years of funding, or we move forward with a year where we examine each program and work with local consultants and experts as well as national ones, and then make a decision about whether future funding or what kind of funding is needed for each of them. I will say that page 29 lists the TSET recommendations. It should be in your packet there. I think they're italicized. So for the Oklahoma Healthcare Authority, I'm sorry, the Oklahoma Hospital Association, it's continuing their programs and focusing on working with doctors, essentially improving the process of referrals by physicians and acceptance of helpline services by patients. If you move on to page 30, the recommendations for the Oklahoma Department of Mental Health and Substance Abuse is to continue their cessation work, which they're doing with a very difficult population. We also think we need to meet with the leadership to discuss future directions. Also need to tap into the Mental Health Association and get some input from Dr. Terry White, and then look at possibly a 3 to 5 year strategy to really increase and innovate with them, possibly involve the Health Promotions Research Center. And then finally on pages 32 and 33, I'm going there. We've got recommendations or suggestions for the Oklahoma Healthcare Authority. And that's really to get together with their leadership and talk about how we can best decrease tobacco use and obesity among their senior care population, possibly focus on priority population of smoking pregnant women. They tend to quit while they're pregnant, but their uptake after delivery is very high. And this is the one where I mentioned about having some experts taking a look at what we can do, especially with the Medicaid expansion, and looking at not only state experts, but national experts. Any questions on this?
Remind me again, how much are the current grants with each of those?
Say that
Sure.
again.
I have that. The current amount budgeted for FY21 for the Hospital Association, it is $593,126. Mental health and substance abuse is $584,788. And our healthcare authority grant is $270,000 and $270,231. It says in this same portfolio is also PMTC, and the total portfolio is about 1.8 million, or 4% of the total budget.
Sorry. So PMTC is in that, is grouped in with that?
They are, but we have a separate agreement with them that they're not on the same schedule to be renewed.
Okay, so that's not part of these 3.
Correct.
And these 3 are about 1.4 million?
Yeah.
Okay. Those are my questions. What you're saying right now is they're funded through 21, correct?
Correct. We would have to decide this fiscal year if we wanted to renew them for another multi-year funding cycle, or extend for 1 year and really take a deep dive in helping them, come up with a multi-year plan. Or of course, the board always has the option to make a different decision and not fund them, but that is not what the committee recommended.
The committee is recommending to move forward like we have been. Jack?
Jack,
He ran away.
So this is Jonas. The committee recommended that they be funded. They weren't specific as to whether we should fund them for 3 years or whether we should take a serious look at the work they're doing and maybe extend or continue their work for 1 year while we do some additional investigative and research work, at the national as well as local level. So it's really about trying to see where we can innovate with them and present that to each of them and work with them on it over the next year versus funding them for 3 full years. And that decision needs to be made by the January board meeting or at the January board meeting. So we can give them an idea of where we're going for fiscal year 22 and on.
Thank you, Jonas and Julie. You guys were doing such a great job that I forgot to jump back in. But yes, that is correct. And I think we were leaning toward just doing it for a year and with the intent of progressing forward.
I think it would be good for us to be somewhat flexible with that based on the unknowns of what expansion could look like.
Correct.
But basically you're saying we don't have to do anything on this until January, or are we voting on something today?
Julie, what's the call on that? Do we need a vote on anything?
we will need a decision by January. We are continuing to have conversations with them, but you would need a motion and a second if you would like to vote to decide whether to move forward with a multi-year agreement or a single year agreement. You could do that today if the board is prepared, or we could continue our conversations with program committee or bring back additional information.
Well, right now we're leaning toward the 1 year, but I don't know if we need to make that motion yet, or if you want to wait till the January meeting. Except I need some guidance here, I guess.
We need to have it decided by January at the latest. You have time to make no decision. This is simply an update based on the conversations that the program staff have had with these grants that are up for continuation.
Okay, Jonas, do you have any input here? Would you prefer us to make the motion now?
My input is that I think what you said as the preference is what we would be leaning toward, but the decision doesn't need to be made now. We probably need to meet with the leadership of a couple of these groups, and it'd be great to be able to do that between now and January.
All right, well then let's just hold off until I get a chance to visit with you guys again. Then.
Okay.
Thank you. All right, move on.
All right, discussion and possible action on phase 2 of the TSET Healthy Youth Initiative. Jonas, we've been talking about that quite a bit.
Okay, so at the August board meeting, and I'm looking at, I think it's page 34 of the agenda.
Mm-hmm.
Rescue presented their model and the details of the work that they're doing in several states. And so I think you all remember that. That was exciting work. I think what is in front of you is sort of a graphic of where we are with these programs. We initially started, I'll go there and then I'll move on to the rest of this, but we initially started with youth media and campaigns around that to include tobacco, vaping, as well as physical activity and nutrition through this year. And then the initial decision was to go to youth advocacy, which is policy development work. It also involves education for those students that are, part of the program. And we thought that we'd kick that off July 1st, 2021. And then the third part of our phase would be the youth character building, which you see there, which wouldn't begin until, although we do some initial work, it wouldn't begin until July 1st of 2022. So if you look at your packet, there are two options. There could be a competitive process with youth service organizations, not only locally, but statewide, nationally. Or you could work with Rescue as a leader in the empowerment field, working with youth, and possibly ask them for a proposal to the board to consider at the January meeting. One would be, starting in early spring, which would be requesting a proposal if it was approved. The other wouldn't start until the RFP would be issued in early spring, and the program wouldn't start till July 1st, 2021. I did go over, I'm looking at page 35 of your packet, and I went over some of the capabilities of Rescue, and I wanted to kind of quickly go over that. They've been in this youth work since 2004, and they've worked with a number of states, and they really are, they have an involvement model which is preparatory, but it's also one that they've applied across all the states that they work with. They build upon all the experience that they have in these multiple locations across each of these states. And I can think of Virginia and New Mexico. They've done some work here. And then they develop strategies based upon, the CDC best practice. So on page 35, I've listed some items of consideration. There's national cost sharing and collaboration. They have a single brand and website, and so the cost and maintenance of anything that's shared would be shared across everyone. They have, in terms of management, they manage things locally, so they bring staff on site to work with youth. And they also work with existing high school groups. So they don't go out and try to recruit new ones. They try to, in fact, engage and incentivize existing groups to work in this area of tobacco control, reducing vaping, reducing obesity. Frankly, they believe that policy changes the environment and systems and eventually social norms. They have statewide campaigns, as you already know from the campaign they're doing with us. And when they do youth advocacy work, they also look at what can be done at the state level to support TSET's priorities, as well as what can be done at the local level to support the healthy living program priorities. They always have tangible measures of progress or metrics, and those I spoke about and identified at the August board meeting. They pay these groups that they engage sort of a subcontract stipend, but it depends on the work that gets done and at what stage that work is done. So at incremental levels, if someone, for example, completes a training or a major campaign event, they may give them a portion of that funding so that they can apply to the work they're doing, as opposed to that club having to do fundraising. And they have an online system where they track projects, and they ask youth to actually use that system to report the work that they're doing. So as part of page 36, I gave you a little graphic there of how things proceed from the statewide campaign to finding groups in high schools, establishing some milestones for subcontracts, doing very comprehensive training with youth, and then collecting measures of progress as those youth go out in their community, then recording that information. And from their point of view, and they've shown it in the presentations they've done, youth emerge as leaders and work with other youth on reducing tobacco use, vaping, and obesity. So in terms of labor efficiency, I also cited that, they have local staff that they hire to work with. This says around 200 youth. And, they're in a position to be able to, once contracted, or if they receive the award through the RFP, to start very quickly in 60 to 90 days. You've previously seen the cost. I think I identified $1 million per year for 4 years. It would run concurrently with HLP. And the oversight for this, because they're managing a large part of it, would only be about 10 to 50% of one of our staff. We looked into locally what local youth groups could or could not do. And really, no one has the breadth and depth of youth advocacy experience and work. and influence that rescue does. And you'll see on page 37 a list of bullets that someone that we would hire or award would need to have as part of the work they do and as part of their experience and expertise. So any questions on that?
Well, I just comment that Jonas, you've just done a fabulous job of vetting these guys, and I don't even think there is a second best alternative. I mean, it just, from an effective and efficiency standpoint, I just don't know how we could do any better than to just go ahead and contract with these guys and make it happen. I mean, this youth focus is one of the key things that we're trying to do in TSET, and it sounds like, why reinvent the wheel? These guys, I mean, we can put the TSET hubcaps on it and get them rolling tomorrow.
Well, I do have serious concerns about it. I'm not about what they've done so far. I think what they've done so far is great. But I feel like this is a cookie cutter program, and we don't need more policy or youth to promote policy. We have the policies in place. We need education, and we need it to be on the ground soon. And so while they've got a lot of great information that they've done in other states, I'm not certain that we shouldn't try to have Jonas narrow that down and have them in our request, I don't know, not have a request for proposal, but to ask them to change a little bit on their way of doing things, because we don't need to spend $500 on the local FFA to get them to all say we all need a anti-vaping policy or that kind of thing. We need to go right to the education portion of it, in my opinion. We have lots of laws in place, and we have people, I know, I can tell you where kids can buy vapes right now in every here. So to me, they're a great organization, but I don't think their cookie cutter plan is exactly right for Oklahoma.
But I think as far as the vaping does, we don't have laws on vaping yet. I mean, or we haven't gotten those policies.
Oh, every school has a policy. Every city has a policy. It's against the law to sell to minors. It's going on all over the place. So, there's quite a bit in place already. Almost all the schools are anti-vaping, and most programs require you to sign that kind of thing. So, I don't want us to be wasting Oklahoma dollars on something that we know that's bad for youth, and we need to move on to educating the parents and families and educate and coaches and people that are in direct contact with the youth. Anyway, I mean, I think it's a great program, and I think Jonas can tailor it, our request, but I'm not sure their general work is what we need for our youth.
So one of the things that I think Rescue has worked well in other states is helping those leaders in those peer crowds adopt the behaviors that we would like to see. But you are right. The youth access piece is something that is starting to be enforced in a little bit more aggressively. And this would be part of a comprehensive approach that involves TSET, the State Department of Health, the ABLE Commission. We all have, a piece to play here. We know that Department of Mental Health also is working with the ABLE Commission on that enforcement piece. The State Department of Health has some federal dollars to do education. And so this is really kind of looking across that spectrum to say, where are the gaps and how do we address the attitudes and the behaviors among youth where this seems to be something that is not associated with being risky, which we know is far from the truth. Jack, you had asked about e-cigarette use in our state, and I was able to pull up a few numbers, and we are no, lost the numbers. That's what you get for bragging. I believe for e-cigarettes, we are the 13th highest rate for use, and that's according to the Youth Risk Behavioral Survey. We have about 27.8 using e-cigarette products. The national average is 32.7. So we are better than the national average on that. However, I think, Michelle, you raised a really good point that this spans across all peer groups, and it's something that maybe adults are not taking as seriously as we would like as well. So we can certainly have Rescue do a proposal, and then it would come back to the board to look at and review. And if it's not satisfactory, then we have other avenues available to us.
As long as they have that input, that we're not necessarily interested in exactly their cookie cutter way that they've done in other states, that we may need something a little bit different. And are they willing to do something different, and at what cost?
Okay.
I
mean, that's just me, but
I think also, they're currently doing campaigns with youth, and they're segmenting the youth. So they're going to have some knowledge about what youth are paying attention to and listening to. And that's going on right now. So.
yeah, I think their media campaign is great. It's very, very informative.
So what is our action on this?
I guess we're going to ask them for a specific proposal. Is that correct? Is that what you want?
That was the recommendation that came out of your committee, if that is the recommendation.
Well, let's do that, and then we can analyze that proposal. Is that okay with you, Casey?
Yeah, I think so. Yeah. Mhm.
Okay, Michelle, you okay?
Yeah, that's great.
So we'll need a vote to ask them to go forward in creating a proposal based on the framework that we would give them. And we'll bring that back to the board in January, and then that will be where you can decide if that's the path you want to move forward on.
So we need a motion on approving this phase 2 of the Healthy Living or Healthy Youth Initiative.
Do we need a motion or just a vote again? Is that what's,
Just a vote.
Okay.
I'm sorry.
Call the roll.
Michelle Stevens,
Yes.
Jack Allen,
yes.
Keith Blaine,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
All right. Overview of TSET Healthy Living Program Performance Report by Honas.
Okay, I'm going to try to begin with an overview of the 5-year accomplishments. Those are found on page 38 and 39 of your packet. Then I'll move to the trends in performance ratings over the 5 years. I think that's page 40. And then I think you've got the performance report itself separate and apart. And I'll kind of go over that very quickly and cite Pittsburgh County as an example. So going to page 38, what I wanted to do here was give you some sense. I'm not going to touch upon all of this, but give you some sense of where we are in this year as opposed to last year. Every year we've given you a report, and we've tried to show you what was accomplished over the 4 years, which would have been last year versus the single year. And this is a cumulative from FY 16 through 20, 5 years worth. We wouldn't see, or we wouldn't we wouldn't expect a major change in partner organizations. For example, I'm looking at the top half of that page 38, or in Oklahomans reached in a year's time. I can tell you that partners went up about 4%, or around 68, and the population count went up roughly 21,000 or so. But there are some major changes that I think we need to pay attention to. If we go down to the tobacco specific piece, we've got 1,238 policies that are adopted and influencing local environments. And that's up by 377 policies over the previous year. That's a 44% increase. That's sizable. Along with multi-unit housing, where, you know, there are that population, the populations with low socioeconomic status tend to be in multi-unit housing, and smoke-free or tobacco-free policies have been an emphasis there, especially in Oklahoma County. And this year it shows 11,722. That's up about 4,671 residents. That's a 66% increase. That's significant too. In terms of Oklahomans impacted by tobacco-free policies, the 1,000,005 there is an increase of 544,000 Oklahomans, or a 55% increase. So that's significant too. And you'll see the same kinds of things with organizational wellness. I'll just point to one, which is the very first one on wellness policies. And you're really talking about policies around healthy eating and policies around physical activity. So the grantees over the last year increased this whole amount by 326 policies, or 45%. So that's major. If you go to page 39, just a couple of things. With complete street resolutions being adopted in terms of, you know, making streets pedestrian friendly, between FY19 and FY20, we actually had 24, which would be a 100% increase over the previous number, which was 24. And in safe street improvements, actual work, there were 35 more, or that's a 75% increase in terms of cities that were involved. And then if you look down on the left-hand side before you get to the food environment, children participating in walk and bike to school days, the FY20 number was 7,263, which brought us to 26,200. That would have been a 38% increase over the previous year. The right-hand column on noteworthy achievements cites a couple of examples. One is in Durant, where Main Street got involved with us. These first two are collaborative efforts and really yield gains in terms of leveraging of dollars. So it's really collaborative work in my mind with big payoffs. The third example around Comanche County is all about policy adoption by a major company, Goodyear, the Lawton plant there. And the final example is an example of how two counties, Marshall and Johnston County, were able to get 100% of the schools not only to have tobacco-free policies, but also wellness policies. That's major. Very few grantees are able to do that. I wanted to go to then sort of the scorecard, which is page 40, I believe. And hopefully you're looking at that. What I want to point out is that in the column that doesn't have a line above it, FY20 rating there, this is for FY20 only in terms of where the grantees are. And they ended up, almost 91% of them ended up being in the excellence category. But you can see across this, for example, K County was excellent every year. Payne County was excellent a couple of years, except for one, they were good 1 year. And so if you want to look at the rating scale, it's to the right of the table. You can see excellent is a score of 137 to 178. Good is a score of 105 to 136, et cetera. So you can see across all these grantees that some of them started out even at, needing improvement and eventually achieved excellence. In the final year, you can see in the little table to the right that virtually, almost 32% that were excellent, but together combining that with good, that would have been 89% of our grantees achieving good to excellent by that final year in terms of their average score, which I think is phenomenal. And then each of the little boxes to the right of the major table just is, it's color coded with some of the grantees to show, for example, in the brown box, there's 4 grantees maintained a rating of excellence throughout the 5-year period. So grantees, I think, really worked hard to achieve excellence. I can tell you that the bottom 5 grantees had a 5-year average of needs improvement, but they achieved excellence in their last year, which is great. Tells me that they were working hard to move up and improve and achieve their objectives. Questions on this?
Looks great.
Yeah, it's very impressive.
Okay.
And if you'll remember, this is the first round that we've had this scorecard, and you can see how it may have been motivational for some programs, helping them kind of achieve that excellence. And so I applaud Hanas and his program officer team in managing this performance and helping grantees achieve those milestones.
I think it's very helpful to us as board members too, to see the progress and see how TSET is monitoring it well.
Great, thank you.
All right, overview of tobacco helpline. Hanas?
Okay, I think, yes, we have Dr. Hart with us. He's serving as an assistant professor. His biography is in your packet. He's an assistant professor with the University of Oklahoma Health Sciences Center, and he's been there since 2016. He's a clinical psychologist. He's also serves on the OU Hospital Ethics Committee and psychology training faculty. Dr. Hart's going to provide you with an update of the Oklahoma Helpline Behavioral Health Program, also a little bit about where My Life, My Quit is in terms of the youth cessation program, the status of the Helpline RFP, which they've been working on, and then just some collaborative projects with our research folks. So, Dr. Hart.
Thanks, Hanas. And I've been told I've got 5 to 8 minutes to do that in. So I've got my stopwatch going and I'll do my best. I've got it all written up in a first quarter update that I think just inadvertently got left out of your packet. But leadership's got that, and I'll make sure that you have a copy that you can follow up with afterwards. So I will just touch base on a couple of programs that we've got going. I've been your director with the Helpline for the past year, taking over for Dr. Gillespie. It's been a roller coaster ride, but I think we have been able to do more than just survive, and we've got some exciting things I think spun up over the past year. So one is the behavioral health program. That's a unique program within our vendor Optum that provides the helpline service for the state. And so I'll give a. Of
course, my earbud went out right as.
We can hear you now, Dr. Hart.
Okay, I'll keep going without the ear.
If you could get maybe closer or
sure
to your mic, we could hear you even better.
How's that? I can talk loud too. Is that all right?
Yeah, talk loud.
Okay.
Got it.
Use my dad voice.
Yeah.
So the behavioral health program that we spun up with Optum, our helpline vendor, we just saw that as an opportunity to capture some high priority groups in the state with the one program. And so this wasn't a pilot with them. This is a program they've had going for a little bit. And so it's been established in some other states. So we could see that data and have a good feeling going in that it's got some evidence that it's been helpful. We liked it because, we've got a disproportionately high rate of mental health conditions reported in our low SES groups, as well as some of our minorities represented here in the state. And so the way that the behavioral health program works, when a caller calls into the helpline, one of the questions that they're asked is the presence of any comorbid mental health conditions. That is then, and so right off the bat, if a person identifies as having been diagnosed with bipolar disorder or schizophrenia, the registration specialist immediately describes and offers them the behavioral health cessation program through the Oklahoma Tobacco Helpline. If they identify a different mental health condition, a follow-up question is then asked, do you see that as having an adverse impact on your quit attempt? And if they say yes, that's going to make it harder for me to quit, then they're also offered the program. What the program does is it increases the amount of NRT that they're able to access through the helpline. So it increases it to 12 weeks. Depending on a person's insurance status, the standard is 2-week NRT that folks are able to get, all the way up to 8 weeks, just depending on their insured status. But the behavioral health program enrollees are able to access up to 12 weeks, and that's dispensed at calls 1, 2, and 3. They also are able to engage 7 coaching calls instead of, the standard insured would only get 1 call covered. Uninsured would typically get 5 calls covered. So this increases the number of calls. And then in addition to that, the call specialist or the quit coach that they're working with through the helpline has had some unique training on specific challenges that individuals with various mental health conditions might have that would make their quit attempt more complicated. So we turned that on mid-May of 2020. So we're up and rolling around June, working with Dr. Beebe to try to pull some initial data, which is going to be in that Q1 update that you'll get later on. So we looked at just Q1 registrations. So general helpline registrations had about 5,400, and we had about 1,400 enroll in this behavioral health program. So it's about 13% of the overall registrations that we received in that Q1 period. Some of the highlights from the program, we had a large percentage, 64% were taking us up on the NRT offer. So we're accessing 8 or more weeks of NRT. You had about 80% who were completing coaching calls, which is consistent with the general helpline. But the thing that was good to hear was even compared to folks who identified as having a mental health condition in the general helpline pool that didn't register for the program, folks who enrolled in the behavioral health program were completing more calls. So we had an average of 2.1 versus a general helpline stat of about 1.5 calls completed. And so almost a full call more when they enrolled in that program, which I think bodes well. We haven't had it going long enough to get outcome data in terms of, did we have a higher rate of people reporting having quit? But we'll have that by the end of this fiscal with the evaluation on the back end. Within that behavioral health program, we did have a larger percentage who identified as low income, so less than 20,000 annually, and it was about 0.25% also reported being Medicaid. So that's just a real quick snapshot of that behavioral health program. I'll zip through these other things, and then if we have any minutes left, I'll field some questions. My Life, My Quit, something that I think goes along well with a couple bullets back, talking about the youth initiative. Youth are currently able to be served through the general helpline, but it just really isn't a tailored program. So we wanted to try and find something that would. So we partnered with National Jewish, who has had this program for, I think, a year or two, that provides live text and live web chat coaching calls. And so we got that going also around the same time as the behavioral health program. About June was when we actually, it was available to be used. So looking at that Q1 data, we've had about 1,200 visits to the website, which is great. Enrollments are still pretty low for enrollments in the program overall. I think we could spend some time talking about, what's up with that. Schools being all mixed up, I think could help explain some of that. But also just, the program's being turned on, but we were kind of waiting to dovetail it with the media push that'll be talked about here in a little bit. So the good news is relatively inexpensive, and we're able to at least get the program started and have the kinks worked out as we ramp up our youth push so that it will be ready and we'll actually have a program specific and tailored to youth to help them with their quit attempts, not just with smoking, but vaping as well. We are in the middle of the throes of working up an RFP to put out the helpline service for competitive bid. The plan is to have that posted and closed by year's end. That's my hope. We will have it posted by year's end for sure. It may be that the minimum time required will push us into calendar year 2021, but we'll have that open and closed within the next couple of months, and be working out the award and whether or not we need to make a transition plan for FY21 on who our helpline vendor is. Let's see, I'm at 8 minutes, 50 seconds. So I've exceeded my time. The last bit I'll let you read on it when I get you that Q1 update in your email box is just talking about some different current projects that we have going. All those HSI grantees that you guys just considered for contracts, we have monthly meetings with and are looking for. We have a potential research project where we've partnered with HPRC on incentives with increasing that referral to engagement process with our ODMH clinics, as well as possibly pregnant women in a research study with OCA. And then we're also working with OHA to try to dig into that referral process and having referrals result in increased engagement. There are a few others. I'll let you read about them. I don't want to bust up the clock too much. Anybody have any questions?
Any questions? Thank you, Dr. Hart. I will get that update to you. I know the program committee got it, but it'll be beneficial for the whole to have it. I think it's important to note that the helpline serves as kind of that main connector to a lot of the things that we do. And Dr. Hart and his team are always looking for ways to maximize and leverage each other for improved health outcomes for the people of Oklahoma.
All right. Thank you. We're on to Public Information and Outreach Committee. Casey?
Okay, we're on item 7A, and what we're going to look at, and I'd like to introduce, and we've met him before, Jeff Gordon, President and Executive Creative Director of Rescue Agency, and Ali Rubinoff, Senior Advanced Account Supervisor, as they give us an overview of our baseline survey for the Oklahoma youth, and give us an update where we stand on the development of our initiative. So Jeff, we'll let you have the floor.
Great, thank you so much. And thanks for having us again. And I'm gonna hand it over to Ali for the first few slides here.
Great. Yeah, thanks everyone for having us. We're excited to share with you some highlights from a baseline survey that we just completed. So as you know, we launched the TSET Healthy Youth Initiative over the summer in Oklahoma. And one of the first things we did was to run a baseline survey so that we could assess the impact of our teen vape and obesity prevention campaigns over time. So on the next slide, you'll see that we, for 7 weeks in between August and September of 2020, our research team conducted an online survey to assess both vape and nutrition related attitudes, knowledge, and beliefs and behaviors among teens 13 to 18 in Oklahoma. We recruited the teens to participate in the survey through Instagram and Facebook advertisements. And on the next slide, we'll talk a little bit about the participants that Sorry.
This is like, Ally, it seems like we had a drag. If you might.
Oh,
go
sorry.
back maybe 30 seconds.
Yeah, so we ended up with a sample size of 403 teens that we recruited through our online survey. These teens, 70% of them reported living in an urban county, and reported living in a rural county. And this urban-rural split is fairly consistent with the distribution across the state of Oklahoma. This map is showing that we talked to teens, our sample included teens that lived in all of the urban counties, as well as each of the rural counties that you see starred here on. So really getting a great sample of information and thoughts from teens across the state as we navigate our tobacco and nutrition prevention campaigns and tailor them to both the urban environment and the rural environment. So our jumping right into our key findings here, we on the tobacco front, we learned that vapes are the most commonly used tobacco product, and that rural youth reported significantly higher rates of vape use when compared to urban youth. Vape users also reported high rates of co-use with substances including marijuana, alcohol, and with cigarettes. And nearly 3/4 of vape users reported that vapes were the first tobacco product they tried. And then also really interesting and notable, the most common way that teens reported accessing vapes was from borrowing them from somebody else. And the most common reason that they reported using vapes or vaping is to relax or relieve tension. And so, this among lots of other things that we learned from talking to teens are all things that we're taking into consideration as we think about messaging and the campaigns that we're going to implement or continue implementing in Oklahoma. So on the next slide, we'll just to hit on a few things that we are going to continue to pay close attention to and to think about as we develop and implement our tobacco prevention campaigns for both the rural and urban audiences in Oklahoma. One big trend that we noticed or that we saw was that disposable vapes, such as Puff Bar, are gaining popularity over Juul, with about 34% higher among vapers. So this is something that we'll continue to watch as this emerging the emerging disposable brands continue to grow in popularity, and how we continue to address that in our creative and in our work. Vape users reported higher motivation to stop or avoid using vapes in response to hearing facts about the effect of vaping on their brain and their body's ability to fight infections. So this is something we also noted as an area to continue to focus on in our campaign messaging. And we did also hear a lot about interest in reducing their use. 46% actually have already mentioned already having tried to quit at least 5 times. So this really supports the need to provide teens with additional resources and support to help them quit, which is something that we'll be focusing on as we just heard about with the My Life, My Quit marketing campaign coming up here in the next few weeks. So on the nutrition front, we talked to we talked to teens as well about their attitudes, their knowledge, their behaviors when it comes to drinking water, eating fruits and vegetables, to really help inform a brand new custom campaign that we're going to be developing for teens and obesity prevention in Oklahoma. And just some key highlights on this slide are that 62% of teens overall and 64% of overweight teens reported that they drank a bottle or glass of water 2 times a day. And 31% of teens reported drinking water less than daily in the past 7 days. Rural teens were significantly more likely than urban teens to report that they drank soda today. And in terms of barriers and reasons for the low consumption rates, the teens that were more likely to report that they did not eat vegetables or fruit in the past 7 days because they either did not think about it, 43% for vegetables and 53% of fruits, or their family did not buy it. That was about equal 38% for fruits and vegetables. So the implications for these are all things that we're going to take into consideration. A lot of great insights to incorporate into our creative development. I'm going to let Jeff take it away in terms of how we're incorporating a lot of our findings here into our creative development and some of the testing we're doing on it as we get prepared to launch this exciting campaign.
Thanks, Allie. Yeah, so the nutrition implications were interesting. The water consumption has a significant amount of improvement that could be made here, but they're drinking soda at times when we would prefer that they drink a little bit more water. So the campaign really should focus on explaining to teens which are these moments where they should be drinking water instead of soda, rather than simply pushing water on its own. Because the problem is that they're over consuming soda, particularly in rural markets. Another thing that we saw was they do have a good intention to eat more vegetables and fruits, so there's not a ton of resistance there. I'm sure there's resistance for specific vegetables, but in general, the idea of eating more vegetables is not that controversial. Their key barriers to doing so included that they don't think a lot about it, and that their family didn't buy it, or that it was not necessarily available at their home. So what we want to do is make sure that we are identifying the moments in their life where it's realistic for them to eat more vegetables and fruits, and that we point those out to them since they are open to considering these items. And we reinforce the importance by connecting it to some of the other benefits that they could get from it. So they generally know this would be a good thing, but we want to let them know here's some of the other benefits so that they think more about it. And we want to be sensitive to the lack of control that they may have around these foods in their homes. And so since this campaign is particularly focused on teens, we want to focus on those moments when they are making their own food purchasing decisions, such as lunchtime and kind of after school snack time, and probably shouldn't spend as much time on like dinner at home, since they don't have that much control over it, and they're saying there's not a lot of access to it at that time. So we're going to focus on those moments where we can change it, since they seem open to making those changes. And then hopefully that'll have kind of like a ripple effect and convince their parents to maybe buy some of those vegetables as well. We also saw that teens were most motivated to drink more water by the statement, drinking plenty of water can help you feel more alert and increase brain performance. So again, we're kind of coming back to this notion that if teens understand the actual physiological benefits of eating healthier and drinking more water, that they're going to think about it more. They're going to think it's more important, rather than just telling them like something's bad and this thing's good. They're smart enough to understand more than that, and they get excited when they know more than that. So our messaging for water is going to focus more on really talking about those benefits to energy, alertness, and brain function that come from drinking more water and less sugary beverages. We also saw that overweight teens were most motivated by the statement to eat more fruits and vegetables when it came to that it can have a negative impact on their fitness and their performance in sports. So this was something that overweight teens thought was important. And so again, we want to make that connection, not a connection generally to just gaining weight, but what else does it do? How does it make you feel when you're trying to be physically active? And we think that, not only does this statement show, but also some of the findings from our interviews show that connecting the dots between some of the feelings that they're already experiencing in the day, such as like, oh, I'm so tired at school, or I'm falling asleep, or I feel like I don't have as much energy during practice, or whatever, that if we can connect that to something they just ate, then that's going to be a really salient message, because every time they feel that way, they're then going to think back, oh, what did I eat? Oh man, I'm sabotaging myself again. And so it's kind of like having a campaign inside their body. If we can just make that connection in their head, then they'll think of the campaign every time they feel that way. So if you go to the next slide, this is where we've been headed with the campaign development. And the campaign development's right now in testing. And this testing is one-on-one interview. So we are talking to them. We're going through deeply like what parts of these storyboards do they like or not like to really understand where they're at. And that's where the ideas are, is, you know, you can even kind of get the spot from that one preview there on the football field that the guy can't run as fast because of this kind of milkshake or slushy thing that's chained to him and keeping him from going as fast. So we're really honing in on that idea of the physical consequences, the immediate physical consequences of eating unhealthy. The other preview there is a spot where a girl is visited by her future self just a few hours later that tells her how horrible she's going to feel after eating this greasy, unhealthy lunch. And we're also testing potential names for this campaign, since this one is a new campaign. The two names that we narrowed down with the TSET team was Swap Up or Flip the Table, because both of them communicate that idea that we're telling you exactly what to change. We're telling you exactly which food, which snack, which side dish to swap or to flip so that you feel better, right? So this isn't a general you should eat more vegetables campaign. This is a, hey, here's the new thing you should order next time you go to a fast food restaurant so you don't feel like this later in the day. So really specific, really focused, and really leveraging the fact, which was an early theory that we had, and we're glad that the research panned out, which was that they are already interested in eating healthier. They just don't know where, when, and how. And this campaign is going to tell them that answer. And that's the update.
I do want to say that some of the findings in this, especially like the 13 to 18-year-olds saying that they didn't have access to fruits and vegetables at home, is also informing our Shape Your Future adult parent campaign, because while we focus a lot on making sure fruits and vegetables are handy snack food for little kids, it's apparent that those vegetable messages need to be told to adults that have teenage kids. So it's like, keep the carrot sticks handy, keep those things, you know, front and foremost in the refrigerator so the teens can access them. So this information has been able to help 2 of our campaigns.
Great, thank you.
Okay, any other questions for Jeff or Allie?
No, that's excellent information.
Okay, moving on into our health communication update. We've got some new information, and according to CDC, we are not getting enough sleep, just in case any of you didn't know that. But it actually is linked to a lot of chronic diseases. And some of the research that TSET has recently shown that Oklahomans, children, are not getting enough sleep. Nearly half, 48% of school-aged children are not getting the recommended amount of sleep. 64% of parents who don't get enough sleep think that their children are getting the right amount of sleep. So we've got some issues there. We've been able to reshape some of our messaging with Shape Your Future, the Power of One. It launched this fiscal year, and it's urging Oklahomans to try one new healthy habit. So in addition to filling your plate with fruits and vegetables, we're also talking about sleep and physical activity and things like that. So those are some new things that research is showing us that we're doing. The Oklahoma Tobacco Helpline and the Tobacco Stops With Me, they've launched new messaging supporting Quit Tobacco. They're closing loopholes in the law, which would protect all Oklahomans from secondhand smoke. All of our brands are meeting plan objectives and all have incorporated the COVID-19 related content on materials. Our partnerships, OUTU Culinary Medicine Program, KJARH TV in Tulsa, and the Shape Your Future hosting weekly cooking segments during news segments. In addition, the OU-OSU partnership with Game Day, supporting the drink water. That's still going on with activity kits. We've got partnership efforts continue with Oklahoma Healthcare Authority, building healthy military communities, and the Oklahoma Hospital Association. We've got tons of information in the packet for you. Shape Your Future stands with information for eating better, moving more, and being placed in October in grocery stores, laundromats, different places. The Tobacco helpline, things are going up in gas stations and pharmacy signs, and really prioritizing zip codes, high priority zip codes for those. Our youth initiative, we've heard phase 1 is moving forward. Second quarter campaign promoting the free cessation services, the My Life, My Quit. That's starting and it's slated for 3rd and 4th quarters. Let's see what else is there. Training platform, the Public Health Academy of Oklahoma. We've implemented a new training center and it's improved our grantees. They've used it for the kickoff on things that we've done. We've had lots of online training with that, and it's really helping. Staff is working with virtual on that, and we've really had some good highlights because of COVID with having those activities available. Our outreach activities, September 29th, TSET presented at the state capitol as part of the childhood obesity interim study. And we were able to use the meeting to highlight the work TSET is doing to address obesity while promoting our statewide resources provided by grants and programs, especially like Tobacco Stops With Me, or Shape Your Future, sorry. October 2020, TSET launched a media campaign around educating Oklahomans about the importance of preventing unhealthy behaviors. The message centers around 3 unhealthy behaviors that are causing 4 major health conditions that result in 65% of deaths in our state. And I know that number really was kind of being retold during the No campaign. It was really, it was nice to have that succinct information out there. Because of COVID, in lieu of in-person speaking, TSET has turned to virtual representation and education. We've created the TSET 101 playlist, which is on our YouTube channel. So check those out, use them often. And Julie is doing educational intros and can go anywhere virtually that we need to. Let's see what else. Tons of other stuff. The newsletters, the newsletter opens are up and we're still making changes on the newsletter. We've got the clips and all in our media packet, so scan through those for your late night reading pleasures. Let's see what else. Item D are sponsorship and training grants. We've approved 6 sponsorship grants so far this year, amounting to $7,000 or 31% of the budget. Most of these have been virtual, and our grant monies required that can only be used for activities taking place outdoors. So we did change those. Thank you for the Oklahoma Senior Games. I'm partial to those, as you well know. Let's see, upcoming events we've got an event for the Oklahoma Institute for Child Advocacy, the Fall Forum. Julie will be speaking at it, the State Chamber 2020 Public Affairs Forum, December 9th. And now that says 21, but it is 20, isn't it? December 9th, 2020. Yep. And State Chamber Legislative Reception is in 21. Yeah. So anyway, we're getting there. We're out and about as much as we can be. And then I guess we've got some information. Thomas, do you have the legislative updates there? Anything that we need to be looking at?
No, only that the bill request deadline is coming up on December 11th. There's an organizational day on January 5th where all the new senators and reps come in. Bill introduction deadline is January 25th, and the first day of session is Monday, February 1st.
Okay. Okay, that's all for my report, unless I missed something.
Think you got it.
Thanks, Casey. Next is Agency Operations Committee report by Marshall.
Okay, can you hear me?
We can hear you.
Very good. Well, you've got all of the information in your packet almost that we're going to talk about this afternoon, but we did get final certification of our endowment earnings as of the end of this past fiscal year, which will be the money we have to spend for fiscal year 2022, and that was a little above 41 million, and that is a reduction that we'll talk about in a minute from the past. So we had about a 33% reduction in our certified earnings. And we'll get into that here in a minute. Anyway, Part B, the expenditure reports, you guys can read all of that. You can see in the first quarter, we don't spend very much of our money. We're on a cash basis. So for reporting purposes, so a lot of this money, a lot of these bills don't get paid until October for the first quarter. So that's why the spending rates are so low. The main thing we want to talk about today is the budget that's coming up. Now, we don't approve the budget till next spring, but it's not too early in light of all the confusion and chaos in our environment to start talking about this a little bit. When prior to 814 failing and prior to the rebound that we've had in our investment portfolio, we were really concerned about the fact that we may have to cut the budget, and the budget may have to be cut significantly. As you all know, 814 failed. That has a positive impact on us, as you all know. And our investment portfolio, we just found out this morning, has bounced back a little bit, and we've got some positive earnings in our portfolio in the first quarter. So that is all good news. Now, if we can skip on down to the, let me just get the right page for you here, page 87. Those are a couple of options that we've thrown out here just for illustration purposes, but so I'm going to skip that for just a minute, and let's go down to the 3-year rolling average, which is the last page in your packet. And this gives you a little historical perspective that I think will make a lot more sense to us. So Suzanne, I know you're new. What the board did several years ago in order to even out the wild swings in certified earnings, they the board at the time adopted a 3-year rolling average process that said, instead of using the certified earnings number each year to determine our budget, we're going to use a 3-year rolling average to try to even out some of those peaks and valleys, and not as an amount of money we have to spend, but as a guideline. So if you look at page 90, it kind of gives you the history of what's happened with the 3-year rolling average and the impact that's had on the reserve fund that we set up to also alleviate any wild swings in the certified earnings numbers. So if you just look at the top line, certified earnings have fluctuated from 39 million in 18 to 65 million down to 60 million. And then for the money that we just ended up with from fiscal year 20 that we don't spend till later, that's 41 million, which we will actually spend in fiscal year 22. So there's been a big decrease. Now, if you look down at the 3-year moving average line, which is 4 lines down, you can see that that number smooths that out a little bit. Then if you look down at the actual budget line / expenditures, so for those years that are past, that would be expenditures, and those years that have not been completed, that would be the budget number. You can see we've been between 45 and $50 million every year. Now, last year we did an across the board cut, as you can see, from 49 million down to the current fiscal year of 46 million. And for purposes of this schedule, we've just assumed that was going to be the same number heading out into the future. Now, assuming certified earnings stayed around the 40 million level, that would allow us to maintain a reserve, which is the final number, line 10 on that schedule. And as you can see going across, that has significantly increased up to this last year where it ended at 67 million. That reserve was also set up by the board several years ago in order to accumulate enough money into a reserve account so that if these wild swing, if the 3-year moving average did not take care of the wild swing, we had some extra money that we could pull down from. And in the past, prior to the fiscal year 18, we did actually draw down some of that money. And actually, we drew down a little bit of that money in this current year. So that would be the reason the reserve went down. So all that is to say that with the positive earnings we had in the first quarter, the positive that we got this morning, the positive news that we got on election day about 8/14, and the amount of money that we have in the reserve, I think we're pretty comfortable that we're going to be able to not have to cut the budget, or if we do, it would be because of some political reason that if the entire state decided to cut the budget, we for some reason would have to comply with that. But just based on our financial position, this looks a whole lot better than it did 6 months ago, or even 3 months ago. So that gives me the confidence to say that if all things being equal, if we don't have any other big gigantic changes in our environment, which is not something we can count on based on this past year, we're cautiously optimistic that the budget's going to be in line with what it was this year. So I've kind of jumped around a little bit on us, but that's the sum and substance of where we are with looking ahead for the budget. I would also caution us when we go into our next board meeting, if we start making decisions that impact the budget for FY22, that we always remember that has to be subject to a final budget approval. And I know that comes back through the program committee to tell us what programs they're recommending that we fund in the future. And then once we know the final numbers as we get closer to the end of next year, we can then kind of put that in concrete. So that is a quick overview of our financial condition at this point. More to come in the future, and obviously in our spring board meeting when we approve the final budget, all of this will get reconciled and they'll be a lot more clear. So with that, I'd entertain any questions. That was so good, I didn't even have to answer a question.
Well, Marshall, that line 6, limited to 5% of the corpus. They haven't hit that since, well.
Ever.
Well, they did. Now,
yeah, I don't know.
I mean, they were trying to give earnings of 5%.
Yeah,
and
that's
above that.
Well, I've always been confused by that, to be honest with you, Casey, because in a traditional foundation, which is where that 5% number came from, I'm told, that is a requirement that foundations have to give away 5%. In our case, we were limiting ourselves to 5%, but it's my understanding, Julie, correct me if I'm wrong, that's a requirement that was negotiated with the Board of Investors. Is that right?
It was a handshake deal. Yeah, it was a handshake deal that we had with them, that they would that they were aiming to return 5% earnings to us. And that was, Ken, remind me, because you were the one that were doing all of it, but it was so that we could at least be projecting this out, and whatever that 5%, they would either make up from the reserve they had or put into our reserve, if it, you know what I'm saying? So they were supposed to be returning that.
Yes. So this is, there's a written agreement between the Board of Investors and the Board of Directors chair at the time, and that was entered into in 2012 after an Attorney General's opinion stipulated a recalculation of earnings, and there was a windfall. And so that windfall became the first portion of reserve, and the Board of Investors held on to that and said, you know, we will work to get 5% of the total value of the fund, whether that's through performance of the fund or make up the difference with the reserve that was held back. At the same time, seeing in that year when we used a good portion of the reserve, the Board of Directors put their reserve policy in place, knowing that the way our earnings are calculated is very volatile, and we needed to put back, up to 2 years of expenditures into our reserve. So as we have been spending down the Board of Investors reserve, put forth because of an Attorney General opinion on the calculations of earnings, we have been growing the amount of certified unspent earnings that the Board of Directors has access to. This fiscal year, we will have 0 in the Board of Investors reserve if all funds are spent as projected with our budget. So that means we no longer have an agreement with them because they can only certify what the fund earned. When they had that reserve, they were able to do a target. And so that's part of an ongoing conversation that we have had here in the last couple of weeks of just what do we need to put in place to get some targets or have an ongoing conversation about where TSET is headed in terms of our cash flow needs. They do have limitations on their ability to invest or change strategies, and so it's getting an understanding of that as well. But yes, Ken Rowe was the chair at the time when that agreement on that recalculation of earnings was signed with the Board of Investors.
So this is a limit on what we can spend. That really doesn't have anything to do, well, I know it does, but that's a different thought than they have to give us 5% return on the money they invest for us. So I don't really think line 6 is relevant anymore, but.
Well, that was supposed to be what that they were returning to us.
I know, but that line 6 limited to 5% of corpus, I think that's a board rule that was passed in the past, and that limits how much we can spend, not how much they have to give us. It's two different things. It's two different 5%. So Ken, they may have been tied together at the time.
I don't ever remember us saying that we wouldn't spend. I mean, our limit on spending is the
three-year
overhead
moving average
is and that limit was the 3-year average.
Right. So I don't think line 6 on this schedule on page 90.
Well, I don't think it's relevant anymore. They were.
Yeah, I don't think it
tried to return 5% to us, and that was what that number was kind of showing us what that potentially should be. If we know what the endowment was, $1 billion, it should be, $50 million.
Right.
Correct. That's my understanding as well. But that was based on when they had certified unspent earnings in reserve that they could make up the difference to us. And you'll see over time that, we followed a 3-year rolling average with our budget target versus the 5%. And so that reserve for the Board of Investors lasted a little bit longer and allowed us as the Board of Directors, a separate constitutionally created entity, to make up the difference, because we've seen our earnings fluctuate as much as 20 million. So we know that past history that we need to have funds in place so that we are not eroding the infrastructure of prevention in our state.
Yeah, it's two different 5%. That's what's confusing us. I'll just read it to you. This is our reserve fund policy. The board shall limit yearly expenditures of certified earnings to no more than 5% of the corpus. So this is a limit on what we can spend in this schedule. And that may have been related to the 5% that they're required to certify for us. But I'm not sure this 5% limit on what we spend, I don't think it matters anymore.
Marshall, you're correct. We were trying to get to a point where we had the ability to budget in a way that was sort of predictable. And so that was the conversation.
Yeah, and I think it's worked great. I mean, this 3-year rolling average has been good.
Oh, lifesaver.
And it's why I think with confidence, we can say, this looks like we may not have to cut the budget next year unless there's some political reason we have to do that.
Correct. Obviously, we were looking at a lot of different scenarios when state question 814 was yet to be decided. And
Right.
we had the downturn in markets because of COVID-related slowdown. So we have a lot more variables firmed up at this point. So I agree, Marshall.
So more to come in the spring board meeting.
Right.
All right, thank you, Marshall. Do we have any new business that could not reasonably have been foreseen? If not, we'll start with the public comment. We're now preparing for the public comment of the meeting. We have compiled the request to speak. This is the final opportunity to request the opportunity to address the board on items contained in today's agenda. And we'll pause for a few seconds. That's 30 seconds. Are you counting?
What is that? They're saying happy birthday 2 times? Is that what we're supposed to do? Wash our
Oh yeah,
hands?
like washing your hands.
It is Sana's birthday, so you can take this time.
Oh, happy birthday.
No.
Do we have any public comment?
We do not.
Okay.
Thanks for the happy birthday.
You're welcome.
Okay.
All right, so a motion to adjourn.
So moved.
Second.
Motion's been made and seconded.
Okay, bye.
Now we got to vote.
Yes.
Michelle Stevens,
Yes.
Jack Allen,
Yes.
Stacy Kilblain,
Yes.
Susan Negatoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
All right, motion carries. Thank you guys. Very good. 4:07, right on the dot.
Great.
Nice job.
Yep.
Nice job,
Good
Miss
to see you,
Emma.
Julie.
Thank you.
Thank you. Have a good
Nice.
night.
Nice roll,